evening, everybody. Hello, hello. How's everybody doing? Welcome to our platform tonight. This is our Talk About You platform, and I am Brand Ambassador Kym Lee King. I'm so excited to be here tonight. I'm so glad that you guys decided to join us. Listen, I need you guys to tell a friend, share this broadcast with someone, because we have something very special in store for you tonight. We are talking about the value of having a second opinion, and we have our very own Dr. Shiloh that's going to be joining us tonight, along with a patient who is going to be giving her own upfront and personal testimony about her experience with fibroids. So I need you to tell everybody that you know that we are live here on the Talk About You platform, and this is a place where you have a safe community to be able to talk about your fibroids and talk about all things uterine fibroids, our solutions. We have so many women that are on here who want to share with you and be able to give you some insight on what they've gone through. And I am just so grateful that you have decided to land here. Now, don't scroll. Stay right here. Tap the hearts. Make sure you tap the hearts. I'm going to wave to everybody here tonight. I think Dr. Shiloh is already here in the building. He's back in our green room. That's what I call it. He's in the green room, ready to go. And I'm ready to have him on tonight. So without further ado, I'm going to join him right here in the broadcast. I'm going to put our number up here so that you can call in and schedule your appointments. If you have any appointments that you'd like to schedule, if you have questions, our staff is ready. Our experienced staff is ready to take all of your calls. And so I'm going to just add that to the comment section right here now. Let's add those numbers here. Listen, and while I'm doing that, tell me where you're coming in from. Tell me where you are coming in from. I want to know what state you're calling from. 833-609. 1100 is our 1-800 number, or our live number, where you can call in. 800 or 833-609-1100. I got to make sure I got that right. Yes, 833-609-1100. This is our hotline. We're going to pin the number here right now. Illinois. Hello. Hey, Naz. Hello, everybody. Hello. Come on in. You're coming in from Miami. Hola, Miami, Florida. I know it's nice and warm down there. Send us some of that warm heat up here to the DMV. I'm here live from the DMV, which is the DC, Maryland, Virginia area. And I think Dr. Shiloh is in our green room. Let's pull Dr. Shiloh in now. To come on. Hello, Just Lovely 31. Thank you for joining us tonight. Bossy, the most hated. Girl, you stopping, girl. Hello, Dr. Shiloh. How are you?
I'm doing great tonight. How are you? Thanks for having me on.
Oh, I'm so excited to have you. I was just saying hello to some of our followers. They have the most amazing names on social media. I have to put my glasses on because I can't always see them. But ladies, gentlemen, all of you who have come in, thank you so much for joining us. Dr. Shiloh, how was your day?
My day was great. Treated a few fibroids today and met a few new people, and just excited here to talk about fibroids. And I know our patient who's coming on has a really powerful story to share, and all testament to her to being able and willing to discuss this very personal problem. And I think it's really nice when women speak to other women. It's extremely important to get the word out, and we can help more and more people. So her story is really, really powerful, really touched me a lot. And so I'm really glad that we're able to share her story with everybody here.
And that's what I love about you, Dr. Shiloh, is that this never gets old to you. You are always so eager and so excited to share with our patients and with our community. And we are so thankful for that, because after a full day of saving, uteruses, saving women one uterus at a time.
That's right.
Let me get out again. Saving women one uterus at a time is what you're known for. And we are so blessed to have you here at the USA Fibroid Centers. After hours, you are on here live and ready to go. I'm going to bring our guest on. I think she's in the green room. Actually, she was, but now I don't see her. So I'm going to actually talk to you a little bit until she does come on. I am so thankful that you have decided to, share your expertise with us. I want to tell them a little bit about you, Dr. Shiloh. You are our leading interventional radiologist at the USA Fibroid Centers and a fibroid specialist. And you do such a fantastic job at doing what you do. And you have been doing this for how long?
Well, that's a great question. Depends on how you look at it. But, I've been treating women's fibroids since I first started my training in 1998. So it's hard to believe that it's over 25 years now. It doesn't feel that way, but 25 years, and probably on my own since about 2002. So over 20 years on practicing on my own. So the beginning is a little bit of training to learn how to do these things and how to be a good doctor to women with this problem, and then subsequently individually since 2002. So it's been a while.
Awesome. Well, listen, we know that we are in good hands. Anytime we have you in the building to discuss this very, very, very interesting topic, it is a topic that has plagued the African American community. Now, we know that over 90% of African American women, unfortunately, will end up with a fibroid. And we're so thankful to have someone like you to help us to get rid of them in the most effective way, which is by way of UFE, Uterine Fibroid Embolization Procedure, which a lot of people, unfortunately, don't know anything about. They're not, I know, offer solutions for my fibroids. And this is just like always, this never gets old to me too, because I just can't believe that you all can take a fibroid and remove it through a vein in just a matter of, an hour or so. And then the person is back to work in a week and they go home and the same day. Like, none of this makes sense to me, Dr. Shiloh, but I know that it's factual. I know that we have a 99% success rate. Is that correct?
Yes, for most conditions, that's correct. If we do an effective job of screening our patients to make sure we're treating the right thing, then yes, the answer to your question is absolutely yes. There are sometimes some technical challenges, but in the right hands, it should be close to 100% technical success rate if we choose the right patients and treat the right things.
That's awesome. And that's great to know because, there are, procedures that are not as invasive, well, actually more invasive. They have less, less invasive with less success. So this is really a good statistic and one that I'm excited about. We have our guest that's in, I think she put us on mute. But I do want to introduce her tonight. We do have our patient, Michelle, that is here live. I wanted to make sure, look, there were two of you in our waiting room, okay? Somebody else was trying to get on here before you, and I don't know who she was. So, ma'am, if you're watching, don't hang up. But I do have a guest here tonight that we already have slated to have a conversation. Welcome to our platform, Michelle. How are you tonight?
Hello. I'm doing great. Thanks for having me.
And thank you for being on here live. I want you just to introduce yourself and tell those that are watching about your experience with fibroids, how many you had, how long you had them, and we want to hear all about it.
Okay, sure. Well, about 3 years ago, I started experiencing some severe pains down in my lower region of my abdomen, and I never knew what it was. I had no idea. I thought it might have been cancer or, some illness that was deadly and severe. So I did research, and my pains were getting worse and worse by the month. Till about probably about 2 years ago, they were severe pains that I couldn't bear with. I was taking about 2,400 milligrams of ibuprofen a day to cope with the pains, and then I finally had some insurance, and I was able to really take care of myself and do some get a real doctor to diagnose me and stuff. So then from there on, she said I had fibroids, but the gynecologist, she didn't understand why I was going through so much pain as I was with just 2 fibroids. I got an ultrasound, and my one fibroid was 5 centimeters, and my other fibroid was, I don't really know how big it was, but it was there. They were both causing me a lot of severe pain, and I I didn't understand how she didn't understand me feeling this way. I had claws coming through my stomach. She didn't understand how I'm feeling this way. So it was very stressful, and I just bared with it, day by day. It was taking a toll on my life, and thank God by Instagram I saw you guys, and I did my research, and my partner scheduled an appointment for me, but the appointment was 2 months out, and I was like, oh no, I can't wait that long. So I rescheduled the appointment myself, and I got it a week out from when I found you guys, and here I am today, saved, blessed, and happy.
I'm so glad to hear that. Welcome to our family. We're so happy to have you. So I want you to tell us just a little bit about your symptoms. I know you mentioned you had some lower abdomen pain, but what are some of the other symptoms that you discovered or that you felt when you were in your worst stage of when you had your fibroids?
My worst stage of my fibroids was probably the last 5 months before I found you guys. I was in a bad mental state, dealing with this for three years. And the pain and the symptoms just got worse and worse month by month. It felt like somebody clawing at your stomach and trying to get out, let alone sharp pains. And it was times at work I would just go in the office and just huddle over, and you can't do nothing to help you. And
You were having a lot of pains, excruciating pain. Did you have a longer than normal period? Like, tell me how bad your period had gotten. Gotten 7 days, 10 days, 14 days.
I never had a terrible, horrible period. It was the most was probably 7 to 8 days. Um, Honestly, yes, but it was heavy bleeding, and now I can say that I just had my first my menstrual couple weeks ago, and it's a big difference. And I was dealing with this for 3 years, so I kind of forgot what normal and regular was.
Absolutely.
So after last month, I'm just forever grateful. There's no words to express it.
Well, I'm so happy that you are in a better place. I want you to talk a little bit. I know we talked about the physical symptoms that you experienced, but I want us to talk about the psychological impact it had on you. And tell me what you were feeling during this time emotionally when you were dealing with these two large fibroids.
I wasn't feeling good. I didn't have very good thoughts at all, honestly. Um, I was in a bad mental space. I really was. I was in a bad mental space. And Dr. Shiloh saw that the day I walked in there, and he said, oh no, you need help. And he got me the help that I needed fast.
Yeah, statistics tell us that, that 21, it's a 21% increase in women who have fibroids, illness, well, not mental illness, but mental duress, where they're dealing with depression and anxiety, even self-directed violence to themselves because of the impact that fibroids has on the emotions. And so I want you to know that you are not the only one who has dealt with this and who is dealing with this. And I'm so thankful that you were able to find help and solutions with us. Tell us how Dr. Shiloh was so gracious to walk you through getting a better space. And what was the conversation like? Because I know you said that your previous doctor did not understand. So what made it so impactful with Dr. Shiloh?
My previous doctor, the gynecologist, she offered me birth control. She wanted me to try birth control for 3 months to see how it, would make me feel, and see what changes are, to stop my estrogen levels. Or so I didn't have 3 months.
Yeah.
3 months I would have been gone. I would have been out of here. So when when I met Dr. Shiloh, I put my life in his hands and I trusted him, and he took care of me.
Yeah. Dr. Shiloh, talk to us a little bit about what you saw in Michelle and how you were able to help her.
Well, first I have to say, Michelle, I mean, all credit to you for sharing this story with us. I know it's very painful, and but it's so very powerful. You know, when I saw you in follow up, and you told me how much it changed your life, I was really dramatically affected by that. And you know, I hear this frequently, but in your particular case, I recalled how I could see you, you know, how troubled you were by how much pain you were in. And I understand how difficult it is to have that type of pain be not addressed, and be told that it shouldn't be doing that, and then you start to feel like it's in your head and it's not right. And I can tell you that, you know, we've learned a lot about this disease over the years, and one of the things that we do specifically is we ask women, and we've learned a lot from it. We ask women quality of life questionnaire when they first come in the door, and inevitably it's a 1 to 5 scale about different things, about how much it affects your life, how much it affects your sex life, how you're feeling globally. You do leave the house, women who have to wear diapers. I mean, it's the stories that you hear, and then we can quantify that by doing a quality of life score. So I see women filling out fives all day long, fives, fives. It's the worst, the worst, the worst. And then 6 months later, we ask them the same questions, and inevitably they're almost always ones and twos.
Mhm.
So I know that they're answering honestly, and you can see the pain in someone's after doing this for 25 years. You can tell that someone is really in a lot of pain, and I recognize that. And I know that, to your point earlier, Kim, about why she's not heavy bleeding, because her fibroid was more on the outside of the uterus, less on the inside. The ones that are closer to the lining of the uterus, the submucosal fibroids, they cause the heavy bleeding. The subserosal ones cause a lot of pain, particularly during the period cycle. And so many women have both problems: intramural, submucosal, subserosal, all the different types, and they can be, overlapping. But in her case, the pain was more dominant than the bleeding, but an immense amount of pain. And I knew that she needed help. And, after assessing her for that and recognizing that, I think we were able to treat her within a week or two, if I'm not mistaken. I mean, as fast as I could get her
Yes.
to get insurance and all that approved. I mean, there's several steps. I'd put her on the table tomorrow if I could, but unfortunately, we have to work within the confines of the system that we're in. So, but it was pretty rapid, right? About a week or two, Michelle. I can't remember off the top of my head.
Like this.
And like that, as quick as I could.
Yes.
And, you know, she, all testament to her. She had, the typical recovery, which involves some pain, of course. But when I saw her 2 weeks later and she was as she is now, I obviously, it's very rewarding and justifying for me to do these things, and makes it easier to just walk into work every day knowing that you're going to be taking care of people who really need help and have been struggling. I always tell patients, your story is unique to you, but sadly, I hear the same story again and again and again. And that's why we do these things. We want to get the word out. We want to try to get more women to get the help that they need, and not be told that there's nothing there for them. So I think it's wonderful that you found us and were able to get the care that you needed.
Absolutely. And with that mental health piece being remedied along with her physical, there's an emotional toll that I know that is taking its place with you. And a lot of women, are dealing with the issues with worry and fear, and anxiety. Many of them are worried about fertility, having children. They're like, am I ever going to be able to have children? And that really takes a toll on the emotional state of a woman. Also, a lot of low self-esteem. I know I dealt with low self-esteem. I was always very fearful of people thinking I was pregnant all the time. People always would ask, when's the baby due? And it would always make me feel, a certain kind of a way. Even difficulty with intimacy. That's also, a huge factor when we talk about the emotional toll of having uterine fibroids and the pain and the discomfort that women will experience. Can you tell us a little bit, Dr. Shiloh, about some of those things that you may have encountered with Michelle, or if she can actually explain that too, if she would like?
I mean, what your points are excellent, and they're true. it's hard to really fathom the depth of which this affects women's lives when they're bleeding for 10 days and then they get a break for a week and then they bleed for another 7 days and they never know what's going to happen. They always have to be ready for it. They always have embarrassing moments where they bleed through their clothes, bleed through their sheets. It affects their relationships with their significant others. There's so many ways that it affects them. And yes, not being able to have children and so forth, which is valuable and important. And, I'm fortunate enough to have helped in the last year, at least, 3 women that I'm aware of get pregnant, one of which is currently pregnant. 2 have had babies in the last year. There may be others. I was just joking with someone today. I doubt I'm the first person they call when they get pregnant. So it's possible that I don't hear about every single person, but I'm aware of at least 3 of my patients in the last year who wanted to get pregnant from and not being able to. And it is an important piece. And, it is very emotionally devastating to either be bleeding all the time, not being able to see that. And then I should mention women who bleed a lot get anemic, and anemia is a real problem. You can't see the person's anemic. They're not wearing crutches. You can't tell that there's a problem. But when your hemoglobin is 7 and normal should be 14 or 15, you're operating on a lot less gas. You're tired all the time. You're cranky. You don't feel great. No one can tell you why, and you don't have a solution for it. And it must be an overwhelming emotional experience, which I know it was for Michelle, especially the pain that she experienced and was told that's not it. We got nothing for you, and was left with no recourse. She was in a deep, dark place and very desperate for help, which we recognized and got her the help that she needed. And I think she can speak to that and how she was emotionally before and now after.
Yes, we definitely love to hear from you. I heard him say that he does the survey and most women start with the 5. Tell us what your number is now.
Negative.
Awesome.
That's great.
You're not even at a 1, so that means
Nope.
you're dealing with none of those things, those issues, or those components that cause us to feel so badly with the fibroids. Let's talk a little bit about it.
Probably about 60 days recovered from the UFE surgery, and it's great. I feel fantastic. I really do. It was definitely taking a toll on me. My relationship, my sexual, my emotional, my physical, everything was off. Nothing was normal about me. I was always fatigued. I was always tired because when you're in a lot of pain, it takes a lot of toll on you. Crying, even just fighting the pain, feeling the pain. It takes a lot of toll on you. Even now today at work, my coworkers see 100% different change in me, and everybody's like, "Oh my God, you're so different."
Yeah, absolutely. Our relationships do matter. Some women, they become very reclusive. They don't want to come out. I know, I had to work around women every day. It was hard not to be around people, but the gratification of people seeing your change is like, it's like so worth it, because I just remember, being very cranky and overly emotional and extra tired. I drank lots of coffee and ate lots of sugar and, did lots of fussing,
Mm-hmm.
it just,
And that's not at
it
all.
was a recipe for a disaster in relationships, right? And I'm just shocked that my family still loves me because I was a bear. I just am so thankful. My ending was different from yours, but nonetheless, it's over, and I'm just glad. And I want it to be over for anybody that's watching us now. If you just jumped onto our live, to our platform, talk about we call this Talk About You. We talk about uterine fibroids. I always do so many mid-commercial break, y'all, because people jump on and off, and I want them to know what we talk about. But we're talking with Dr. Shiloh tonight. We're talking to our number 1 doctor for the USA Fibroid Centers and a fibroid survivor, a UFE survivor. And I'm so thankful for your yes tonight, that you were able to share your story. Let's talk a little bit about the physical health and the quality of life that you had. You mentioned and you touched upon it a little bit, but I do want to let those that are watching know that research shows that fibroids can be comparable to chronic disease, much like heart disease and cancer, diabetes, breast cancer. And so we are facing, or we're standing against some really big giants with the fibroids. And I know that physical health and quality of life, it should be important to everybody that's watching. It should not just be something that we yearn for, we wish for, but we should be able to have a good quality of life. Dr. Shiloh, please comment on what you've observed as it relates to not only Michelle, but some of your patients with their physical health and their quality of life, how they come in and then how they leave.
Well, thank you for asking that. I have found over the years that one thing that's startling is that, number one, many women suffer for a while before they ever even get a diagnosis. Okay, it could be 5 years of bleeding, pain, and they've been in and out of the gynecologist's office, so it's not like they haven't seen them. They're looking for solutions. Then one day, someone finally just says, "Oh, maybe your uterus feels a little big. We're going to get an ultrasound." Then they get a diagnosis. Great. You'd think, okay, great. Now you can get treated. Nope. Now they go for years with all kinds of things. And many times then they're just offered a hysterectomy, which most women would, given a choice, would not choose. Now, many women are not given that choice and end up getting that done. There are 400,000 hysterectomies done in the United States every year. The vast majority of them are on women with fibroids. A small percentage are on women with cancer, and that's what they need to have. But women with fibroids make up the vast majority of the hysterectomies done in this country. And as you discussed before, the vast majority of women who have fibroids are women of color, Black and African American women. Now, of course, women across all races and ethnicities suffer from fibroids, so everybody. But what's happening is systematically removing women's uteruses in this country, 400,000 a year at a time. That's a problem. And it startles me that it continues on to this day, and it just does. Now, one of the things I tell every woman is women I find are so amazing. My mom, my daughter, and other women in my life are just so strong. And what they do is they take care of other people before they take care of themselves. And they do a great job of nurturing other people in their lives, their husbands, significant others, spouses, other people. They put other people first and them second. And I tell them, listen, you cannot take care of other people until you take care of yourself. It's very important. You must take care of yourself before you can help and take care of other people. And I think once they hear that, it really resonates with them. Take the time you need to get this done. It's a 30-minute procedure. It's a 7-day recovery period, maybe a little more, a little less, depending on different, factors that are at play there, but it's a short recovery. No incisions are being made. No cuts have to heal. And before you know it, you're back on your feet. And like in Michelle's case, like a brand new woman. Like I tell them, you're going to be shot out of a cannon now. You're feeling great. Your whole life is turned around.
Mm-hmm.
Yeah,
Slaps. Yes.
Go
Good job.
I was like, I had this vision of being on an airplane when the stewardess says, put the mask over yourself first, and then you save everybody else, right? And I think that we naturally, as women, because we're nurturers, we automatically are going to do that. We're going to take care of everybody else first. We're not going to listen to the stewardess. We're not going to listen to Dr. Shiloh. So we have to, because here's the thing. If we're not here, they're not going to get taken care of. Nine times out of 10. So, ladies, you got to listen to the doctor. Michelle, did you have something that you wanted to say about that? Did you want to chime in?
Just a little bit. I was nervous about the procedure. I was very nervous, but he said it was a non-invasive procedure, and he told me he could go in through my wrist. So I'm like, okay, sure. Day of, I'm going in there, thinking that I'm gonna get a little wrist incision, but my artery, they went swiggle. They were on a swivel. So Dr. Shiloh said, well, we're gonna have to go in through your groin. So that made me a little nervous because I've never had any kind of surgery or any kind of anything like that put to sleep except with my wisdom teeth. So we're in there. I'm like, okay, cool. I'm in there with the nurse, getting all done up and everything like that, getting nervous. And then they're like, okay, well, you got to go on the table. I'm like, go on the table. So I go in the room, and there's like a big it's like a big operation room. But, you know, the doctors came in, and then Dr. Shiloh came in, and he made me feel comfortable and calm me down. And the last thing I remember saying, "Is that what I'm looking at up there? You're in my leg." And it was over, and I was waking up, and I was in a little bit of pain. And the recovery was only about 4 days. I was back to work day 6, feeling great. And I couldn't do it without Dr. Shiloh.
I am so happy to hear this. Dr. Shiloh, tell us the importance of getting a second opinion with a surgery like this.
I, you know, I can't, I couldn't, I think it's a very important thing. Women, first of all, if you just talk about basics of medicine, there's a thing that we have to do, and it's called informed consent. So when you consent somebody for a procedure, whatever that procedure is, you have to talk to them about the risks and benefits of the procedure and what alternatives they have to that procedure. So a lot of patients I talk to, and I say, look, this is what I'm suggesting it's going to work for you. You can go and get a myomectomy, which is the removal of the individual fibroids. You can get a hysterectomy. I know you don't probably want those. They have an average of 8-week recovery period. And one of the troubling things, and you kind of touched on it a little bit earlier, one of the things about, say, Michelle's case and others, is though the ultrasound diagnosed 2 fibroids, let's say they were 5 centimeters and 3 centimeters, what it may not have seen are the 5 millimeter fibroids and the 1 centimeter fibroids. They're little peanuts. So what I see happening, I saw a patient today, in fact, who reported that she's had 3, count them 3, myomectomies, which are individual fibroid removals, because they take one, a couple years later, they say, oh, a new one grew. They take that out. Oh, a new one grew. They take that out. What's actually happening is that the little smaller fibroids are growing after the big one is. The analogy that I use is in a forest where you have giant trees. They're blocking out all the light and they get all the rain. Underneath are the little saplings. Someone comes along and they take out the big tree one day, they cut it down. Now the light and the rain can hit the smaller trees, the saplings, and boom, they start to grow. So when they remove these big fibroids, the little ones start to grow. The nice thing about the fibroid embolization is we take care of all the fibroids, whether there's 1, 5, 10, or 30, whatever number, they all get embolized simultaneously, including the little baby fibroids. And humbly, I can say that in my career that has now spanned 25 years, I don't recall ever having to re-embolize a woman that I've treated. Now, it could be that a woman who's 30 years old, who has 25 years of menopause, may end up growing new fibroids. Fine. But in general, this procedure is effective, it's safe, and long lasting. So hopefully Michelle will never have this problem again. If, God forbid, in 10 years, she calls me up and says, I got a new fibroid that grew, we can repeat the procedure, and that'll be that.
I think that's awesome. That's such good information because I didn't know that myomectomy really kind of just addressed just one fibroid.
They could take out a couple big ones, but they don't go after every one. If a woman has 2 big ones, they might, in her case, have taken 2 fibroids out. It's possible, but she might have 3 baby fibroids, and those baby fibroids will be adult fibroids in a year or 2. And she's like, I don't even know what happened. I had 6 months of break, and now they're back again. And their explanation is, oh, you grew new fibroids. No, you didn't. They just didn't take care of them. How do I know this? Is that when we do MRIs on our patients, she only had an ultrasound, which is fine because I know I'm going to treat all the fibroids. In certain situations, I get an MRI for various reasons. When I do an MRI, I often see that that woman who we were told has 3 fibroids has 3 fibroids that are big, but countless little ones all over the uterus. And that's how I know that despite the fact that we count them 2, 3, 4, 5, there's many more if we really drill down on every patient. And so that's how I know, because I've seen thousands of uterine MRIs to know that what they look like before and after. And, I don't put every woman through the MRI. It's a difficult test. It's a little, a lot of noise in a coffin. Maybe people don't like it. It's got to cost $1,000 to $2,000. So I know I don't need it. In some cases I do, but when I do get it, that's when I understand, hey, there are way more fibroids than we were really looking at before. And I take that information and I use it. So I know that many women have many, many more fibroids than we're able to see with the ultrasound.
This is a great conversation about treatment options because I'm curious to know how, Michelle, even found out about the UFE, because it was not offered to me. And I heard you say that this procedure has been in existence for over 20 years. This was not an option for me. Michelle, tell us a little bit about how you found out about UFE.
Well, I was desperate for a second opinion. I was desperate for a second opinion because that lady was lying to me.
And that lady, were you talking about your gynecologist?
Yes, she was
Got
lying.
it. Okay.
She was lying
Okay.
to me. She said, well, the only thing we can do for you is surgery, and I don't want to have to do that to you, so let's try this birth control. No, I'm going to figure something else out. And my girlfriend, she loves being on social media, and she does research and all that stuff, and she pulled it up for me. She was like, hey, check this out. Have you ever seen this? And I was like, no, what is it? And it was the USA Fibroids of America Center, and I checked it out, and I was like, yes, schedule me an appointment. I don't care if I got to go to Arizona to see them.
So did you come out of state, or are you there in Pennsylvania with Dr. Shiloh?
Philadelphia with Dr. Shiloh.
And that worked out perfect for you then.
Oh, yeah.
And
Oh,
you
yeah.
guys have centers all over the country. But Dr. Shiloh is the best. I've already offered to drive two potential patients, okay? And we're getting in a caravan, and we're
Oh,
pack the car, and we're driving up to Philly. It's not far. I'll go with, and sometimes you need that. You need somebody to kind of rally for you and just kind of back. But you also rallying for yourself. And Michelle, I appreciate you for saying, you know what, this lady is lying to me, and I need to get some more help. I need to get some more help. Dr. Charlotte, I want to talk about this UFE. I scream praises of it. Unfortunately, I was not able to be a candidate for it because I was too far gone, and they ended up giving me a hysterectomy, emergency hysterectomy. But I want you to just tell those that are watching the benefits of having this amazing procedure called uterine fibroid embolization.
Well, we'll do that, but I want to actually say one thing because I don't know that you necessarily picked up on this, Kym, but her partner found us through the work that you are doing on Instagram. And
wow.
so she did say that, and I heard that, and I know that. And I think that, you should think to yourself, as much credit as I did get for doing the procedure, she wouldn't have gotten to me if it wasn't for the work that you're doing. And so you really, deserve as much credit for bringing her to me as I do for treating her. And you should remember that because this does have a tremendous amount of value, what we're doing. And you're looking at a patient who, her words to me, where you saved my life, her life was saved because of the place that she was in, because of the work that you're doing to spread the word. And I just want to thank you for doing that. It's really, it's actually a really important thing. I just want you to think about that. Okay. I mean, I did the procedure, but I'm being honest that after 25 years, the easy part, getting people to me is a harder thing, and you should get credit for that. And I want you to remember that when you're doing these things. Okay. It's extremely important.
And I got
So
you
I want to thank you
back.
for her and me for doing what you're doing.
Yes.
Now, back to what we were talking about. The benefits of the fibroid embolization is you get to keep your own uterus. And there are many benefits to that you don't hear about down the line. The uterus has a function in the pelvis. Even if you take childbirth out of there, it holds structures together. Your bladder doesn't have to fall through your vagina later on in life. You don't have to get hernias through the incisions. You don't have to get small bowel obstructions. There is data now to suggest that women who have a hysterectomy have an increased risk of getting breast cancer or heart disease, not on an individual basis, but when you look at large volume of patients, women who have hysterectomies, women who don't have hysterectomies, those who have had hysterectomies have a higher rate of heart disease and breast cancer. We don't know exactly why, but it's there. So why in this 2024 should a woman lose her uterus when she doesn't have to? And that is a very, very important question to ask. And we ask that all the time. And that's why women should seek out other opinions. There are alternatives. And especially with us, I mean, look, I don't treat everybody. I mean, I'm being honest. There are women who need something else done. But the vast majority of women who have a benign condition, it's not cancer, should not have their uterus taken out, period. End. And they should have their uterus. Removing the uterus removes the nerves that are sometimes associated with sexual enjoyment. These are things that should be important, and making incisions across the abdomen, the effects that has. Yes, I couldn't go through her wrist because her artery was too small, However, I've been doing them from the leg since 1998, so that's no big deal. We do about 1 out of every 5 patients from the leg, the vast majority from the wrist today, and that is my default. But I also try to do things safely. So I scanned her. I determined it would be a little more difficult. I didn't want to run into a problem, so I went with the, good old-fashioned way. But, it doesn't matter which way you go. They both work the same in the end, and the results are the same. So at the end of the day, before I forget, I want to thank you, Kym, for getting Michelle to me. I want to thank Michelle for being brave enough to tell her story today. And it's just really powerful. It means a lot to me, and it helps me keep practicing and hopefully for a while.
Dr. Shiloh, I can't get myself together now. I got eyelashes on. Eyelashes, Dr. Shiloh. Nobody gonna help me. Ain't nobody gonna help me after the time when these eyelashes fall off, Dr. Shiloh. Now I'm a makeup artist, but I can't get myself together now.
Yeah, well, I'm sorry to have done that to you, but I don't want to forget that. And I hear that. And when I hear that, I think, what, all credit to you. And I really do. I think you've probably put, I don't know the numbers, maybe someone does know, but I wouldn't be surprised if 100, 200, 500 women have now come to our various centers. I know plenty in my office who've come to us from the work that you're doing and spreading the word. And I think it's fantastic, and I hope you keep doing it.
My trophy is here. You guys gave me a beautiful a beautiful trophy last dinner, and I think I had over 500 women to sign up.
That's amazing. That really is amazing, Kym.
So shout out to USA Fibroid Centers for allowing me to utilize this platform on my platform. So I am so thankful for this invaluable information, Dr. Shiloh. We've talked about UFE. You talked a little bit about hysterectomy and the reasons. I want you to talk about hysterectomy and how this particular procedure, what the effects are. I know you said that sometimes after hysterectomy, you run the risk of having heart disease and perhaps even breast cancer. But what are some other negative, the negative effects of it? And not just that, but tell us the difference. Why would I be able to get a hysterectomy versus, a UFE? Is there a reason why doctors choose? Tell us a little bit about that.
Yeah, that is unfortunately the $1,000,000 question.
Okay.
I don't know. I have answers. I try to make it so that I don't want to be too pejorative towards my colleagues in OBGYN. However, when you go to McDonald's, hopefully you don't go often, they will only sell you what they sell there, which is a Big Mac or a quarter pounder with cheese. They will not sell you a Whopper from Burger King, no matter how tasty it is. And that's part of the problem. They will only offer you what they have in their hands and what they think is best for you.
Right.
And that's that. This procedure has been around since 1995. 1995. It's the single most studied and evaluated medical surgical procedure of all time. And it's validated, it's in everywhere. So there's no reason why it shouldn't be offered other than the fact that they're not the ones who are offering it, period, end. Now, there are some very special situations where the UFE is not an option, but it's rare, and we will assess for that. I have colleagues in the city of Philadelphia that I refer patients to who need something other than a UFE, but the vast majority of patients can be treated with a fibroid embolization, which we do in our office, 30-minute procedure. You're in and out in 2 to 3 hours. And get you on the road to recovery without any incisions being made. There's no cutting, nothing's being removed. You don't have to lose what is a very valuable part of your body, your uterus. I mean, it really defines what women are, and it doesn't have to be taken away from you. So it really is important to look for people who will offer alternatives. And a lot of the patients come from this and asking their doctor, isn't there anything else, or being frustrated by their answers that there is nothing else. To offer a young lady like Michelle a hysterectomy at her age is incredible to me. And it's a challenge to overcome this, considering this procedure has been around for so long. But again, through the work that you're doing, our USA Fibroid Centers is doing, the work that I do on a daily basis, the work that women like Michelle do, spreading it by word of mouth, is how this is going to continue to take over, hopefully eventually, from hysterectomy, which is an old procedure. On a yearly basis, I get 5 to 10 patients from the gynecologist. I get 300 to 400 from this, and that's women seeking something else. It's a shame, but thank God we have this platform and that we're doing this, because otherwise it would be a real problem. And so I'm grateful for it. And I don't know, I hope I answered your question. Sometimes I need a little timer.
No, I'm actually gonna deviate a little bit, because I'm actually gonna talk to our marketing team and ask if we can do a live about the I didn't even know that this could be directed to a person who has heart disease, who might potentially want or have to get a bypass. Ironically, Dr. Shiloh, I've had 3 people in my circle to have bypass surgery in the last 2 weeks. One of which was my husband's business partner, who unfortunately just transitioned. And so I am blown away right now. I'm getting ready to be a bucket of tears all over again, because we have literally been in and out of the hospitals for the last months, dealing with patients who have heart issues and who have, of course, gone to a cardiologist first. So this is good to know that you guys can remedy that as well through interventional. It's interventional. Let me say it right.
Interventional radiology, but no, listen, I without knowing the specifics of these people's cases, I don't want to confuse things a little bit. I was just suggesting that the analogy is that 30 years ago, everybody was treated with open heart surgery. 30 years ago, everybody was treated with hysterectomy. Fast forward 30 years, most patients are eligible for angioplasty and stent in their heart, but we haven't moved in the same way for women's health. Instead, we're still taking out uteruses. So 30 years later in heart disease, things are being treated with angioplasty and stent, not surgery. But in women's health, it's still surgery is the first choice for everything, when it shouldn't be. So my analogy is that we should be moving to the minimally invasive procedures, just like they did in heart disease, by doing UFEs on 200,000 women a year, 300,000 women a year, instead of all those women getting hysterectomies. But sadly, we don't get to those women before they get their uteruses taken out by the gynecologist. So that's the shame of it all. It really, if we were able to see patients simultaneously and they got to hear what their alternatives were, I'm pretty sure most women would choose not to have things taken out.
And just in layman's terms, everybody, listen, you have options. That's really ultimately what that whole dissertation was about. You do have alternatives, you do have options, and you should ask those valuable questions. Be your own patient advocate. You have to be, because unfortunately, like he said, doctors are going to offer you what they provide, right? And so if you can ask those questions, is this something that is, and it might be something you can't answer, Dr. Shiloh, but is this a question we could ask a gynecologist if that's the only option they give us, which is hysterectomy? Can we ask about UFE, and can they direct you to someone? Like, can you get a referral to you? Like, how does that work for a person that's watching us? Maybe they have a conventional kind of insurance plan where they don't have doctors there to do UFEs. I don't know. Like, I want to help people as much as I can.
I mean, I saw a patient yesterday who drove from Ohio. For me, that's a 6 or 7 hour drive to come and see me. So, between myself and the docs in New York and all over the country, we have the ability to help people from all over the place. If they call the number, they'll find the closest doctor. If people want to specifically see me, I don't have a problem with that. I love that. I can do telemedicine visits with people, just like we're doing now. We talk about things, and then I review their imaging, whatever they may have. I can't obviously scan them in person, but we can do that. And then we can make certain arrangements if they need to be treated, or they can certainly find someone locally. And absolutely, I believe that obviously my patients are intelligent enough and bright enough to be able to understand their options, and I give them their options, and they should, in every situation, ask their gynecologist, is this really the only way? Now, one of the problems, Kym, is that if I think it's a problem, let's say you had a relationship with your gynecologist, it was a good relationship. They delivered 3 of your kids, same doctor for 15 years. 20 years, whatever the number is. Then you finally get diagnosed with fibroids at age 45, and then you know this doctor, and he or she says, you need your uterus out, Kym. And you're like, okay, but is there something else? How about, and they're like, no, that procedure doesn't work. It's not for you. Now, what are you supposed to do? You're a patient. The doctor that you trusted now to do all these things for 15 years is giving you this information. It puts you in a very bad spot. How are you supposed to know what's right or wrong? So it's tough, but you should ask those questions. Can I explore other options? Is there something else? And a good doctor should say, yes, these are the alternatives. You can certainly look into it. I would hope that they would do that. I really would. I just, I'm not there in all these appointments, and I'm sure it's not happening, but I wish it would.
Well, you just told my story, and I feel judged. No, but I was 45 when I had my hysterectomy, and that was the only option that was afforded to me. And because there are 4 instances where that option will be afforded to you, and the number 4 is mine, and it was a time constraint. She just didn't have the time. She was extremely busy, and this was I actually was the last surgery. Dr. Shiloh was the last surgery that she ever did before she retired.
Oh, sorry.
The doctor who delivered my, she was she literally, like, she was in my life forever, and I trusted her. And she was like, you're my last surgery, woo-hoo. Like, it was almost like a celebration. And I was like, okay, I guess I should be celebrating. We're taking the uterus out. She's like, no more periods for you. You should be thanking me, because I wasn't going to do another surgery, but I'm going to save my last one for you. And I literally was like, okay. And it was really emergency, because she said, you don't have any other options, because at this point, Kym, you run the risk of getting cervical cancer because you waited too long. And I believed her. I believed her.
Now,
Dr. Shiloh.
what are you supposed to do, Kym? That's not your fault. You were a trusting person, and this is your doctor. She was your doctor, and I don't know that most people have the ability to question that person in that situation. You can't. In truth, you did what you thought was best because the doctor advised you that was it and did not tell you there was anything else. And how could you know? You just can't. And the internet is fraught with good and bad information, and it's just very challenging. You were in a tough spot by all means, and you just trusted your doctor, and that's what lots of women do. It's hard for them. I wish the doctors could be educated like this. And you got doctors on Instagram, we've seen them, who are on an opposite side of this coin. I would love to debate them one day. I'd be very curious to see what their answers would be to my questions, but I doubt that they would be accepting of that. I've seen some pretty famous OBGYNs out here with got a gazillion followers, but I'd love to talk to them. Let's see what they have to say with the questions that I have. But
Look, I got a platform. Let's set it up.
Now let's do
money.
it.
Me and Michelle got your back. We got your back.
That's all about the money. They want the money. That's all they want.
Any final thoughts for us? I know you have we have journeyed with you through one of the toughest periods of your life. What advice would you give a young woman or any woman that's watching tonight who is in your shoes?
My advice to you guys out here that are going through and dealing with painful or hard periods, or I can't say that I don't know the painful period, the hard period, but I know about the painful side. But call Dr. Shiloh. The number, USA Fibroids, is at the bottom. I 100% support them. And always take a second look. There's always something out there. Without the internet, you never know what you're going to find. And Dr. Shiloh got your back.
Yes, he does. He does. Dr. Shiloh, did you want to close out with anything?
And thank you, Dr. Shiloh, for my life. You turned my life around 100%, and I couldn't do it without you.
Listen, I am speechless, but I'm honored to hear from both of you. I'm really honored, Michelle, that you chose to join us. I know when I heard your story, I suggested to our team that you speak, because I know how powerful it is. I want to certainly thank you. I'm always honored by every individual patient, every woman who, as you said, puts their lives in my hands. I take that responsibility extremely seriously. I Michelle knows that I give my patients my cell phone number, and I encourage them to contact me directly if they have any problems after the procedure. I don't, I just, because I would like to treat people the way I would want to be treated. I've had things done where I've been trying to look for the doctor afterwards. I have a question. I can't find somebody. I know how scary that feels. So I don't want them to be scared. It is a lot to go through. They're going through a lot of changes. And I think that I just try my best to look at the their care as what I would like to have done for me. Again, I'm honored that you chose for me to take care of you. I'm really, blessed to have people like you in my life, and that you are helping women, and you're helping Kym get women. I don't want to make you cry again, but help women get to me. And I think it's you really should take a moment, and even after this is over, and just, step back and remind yourself that you're really doing an amazing job. And Michelle, I'm really am happy for you. I'm so glad. I know how much pain you were in, and I know that you don't have to experience that. And I can only imagine what that must be like. And, I'm just grateful to everybody, and I'm glad to have been here tonight. And I thank you all for participating in this and spreading the word, so we can help more people.
Yes.
Wow, amazing. Listen, thank you so much, Dr. Shiloh. Thank you, Michelle,
Thank-
for sharing your heart and your testimony. I want to also thank everybody that joined us tonight. And for those of you that join in later, because so many of you come on later next week or the weeks after, or weeks to come, we thank you and we appreciate you for joining us on the Talk About You platform. This, again, is a place where you're safe. We got answers, we got solutions, we have stories that we're telling, and we have solutions for you, and we are just ready to help you. We're ready to help you. Remember, if I had to leave with one piece of advice, remember, you got to take care of yourself first. This came straight from the doctor before you take care of anybody else. So leave on that note, and I want to wish all of you a wonderful evening, and we'll talk soon. Peace. Thank you, guys.
Thanks, Kym. Thanks, Michelle.
Thank you.
Thank you.